Hello, everyone. Let's discuss the diagnosis of bipolar disorder. This diagnosis of bipolar disorder comes under Unit 2, that is mood or affective disorders. I've picked up this question from the specimen paper 2024. This is question number 3 under the heading of clinical psychology. So, if you have a look at the question over here reads Asha is a student at school who has been diagnosed with bipolar disorder. So there's this girl with the name Asha. She is a student at a school and she has been diagnosed with bipolar disorder. This is the information that the examiner has provided us. Let's move on to the question. The question reads, explain how two characteristics of this disorder might affect Asha at school. Explain how two characteristics of this disorder. Of what disorder? We're talking about the bipolar disorder over here. For this, I'm sure you'd all agree, we need to have an understanding of the diagnosis or of the characteristics that help an individual identify if he or she has bipolar disorder. So, having a look at this, if we talk about bipolar disorder, type 1 bipolar disorder, for anyone to be diagnosed with type 1 bipolar disorder, he or she should have at least one manic or mixed episode. A manic episode lasts for at least 1 week. This is marked by extreme mood. And when I talk about extreme mood over here, we're referring to high self esteem, euphoria, irritability, high levels of anxiety, or high levels of activity, energy. Number 4, may speak quickly. Number 5, may act impulsively. Number 6, reckless behavior. Now, you might as well pause over here and try memorizing this. So, for anyone to be diagnosed with type 1 bipolar disorder, where we're talking about an individual experiencing both mania and depression, an individual should have at least one manic or mixed episode. And what is a manic episode over here? A manic episode is marked by extreme mood. And examples of extreme mood could be high self esteem, euphoria, irritability, high levels of activity or energy, may speak quickly, may act impulsively, or have reckless behavior. And this should last for at least 1 week, right? So I just opened this up to show you what mania looks like. Taking this ahead, going back to the question reads, explain two characteristics of this disorder which might affect Asha at school. Now, having a look at the marking scheme for this particular question, the marking scheme for this particular question over here reads, for each characteristic, remember we're expected to write down two characteristics, right? So for each characteristic, award 2 marks for a detailed explanation of symptom of bipolar disorder linked to school. So this should be linked to school. Remember, Asha is a school-going young lady. This is a 4-mark question. We asked to give two characteristics. So for each characteristic, we are expected to write enough to be able to score 2 marks. Taking this ahead, if we talk about the characteristics of this disorder, high mood and low mood, I just showed you a couple of examples of high mood. High mood phase symptoms are number 1, they could be euphoria, happiness, increased activity or energy. Number 3, racing or fast thoughts. Number 4, impulsiveness. And if I talk about low mood, let me pick up another color for this. Low mood phase symptoms over here include number 1, depressed mood. Number 2, low energy or oversleeping. Number 3, lack of interest in normal activities. Or you could say other symptoms might also include a change in weight, a drastic change in weight, change in the sleeping pattern of an individual, or exhaustion. Now, based on the information that we've received from here, I'd like to strongly advise, if you do not know of these, you might as well pause. It wouldn't take more than a minute. Try learning them. Try learning them so that tomorrow you could put this information to use when you come across any other question. So, Asha is a student at school who has been diagnosed with bipolar disorder. Explain how two characteristics of this disorder might affect Asha at school. If we talk about what the answer would look like, we could say, One of the characteristic of this disorder is manic episode, manic mood phase, where the person has racing or fast thoughts. Due to fast thoughts, she will find it really difficult to concentrate during her lessons and do her homework. So this could be one. Number two, another characteristic of this disorder is lack of interest in normal activities during the low mood phase. This could cause Asha to withdraw from social activities at school and feel more depressed due to lack of social engagement. So easy peasy, you get the first mark from here, the second one from here, the third one from here, and from the fourth one from here. Taking this ahead, so this is what is required of us, the first characteristic and the second characteristic, and this being linked to Asha. Now, this is question number 3A. And if we have a look at question number 3B over here reads, explain one strength of the diagnostic guideline of mood or affective disorders. This is a 2-mark question. You are expected to explain, and you need to explain one strength. There are numerous points that you see written down over here. Remember, pick up only the point that you think you can elaborate on, or pick up only the point that you think you can explain. So explain one strength of the diagnostic guidelines of mood or affective disorders. Having a look at this, the criteria ICD-11 have been developed by experts in the field and are regularly updated. Now, if the criteria that has been developed, it has been picked up by experts in their own fields, and if they're regularly updated, this automatically improves the validity of the guidelines. One. Number two, these guidelines are considered to be holistic guidelines with many different types of mood disorders given. This will help the patient to get a very precise diagnosis and treatment, such as for bipolar, there would be different treatment. For unipolar, there could be different treatment. So that again can be considered a strength. The third point that we have over here, they're used in many countries around the world because ICD has world recognition. The ICD is published by WHO, that is World Health Organization. So they're used in many countries around the world to diagnose mental health problems. So have good generalizability. Mood disorders can be diagnosed in a similar way across the world. So because this is used widely, because this is very popular, this could add on to the generalizability as well. Number four, guidelines are considered to be objective and give a precise outline of the mood disorder and its symptoms. These guidelines are considered to be objective or without your personal biasness being involved into it. And because of their objectivity, automatically that adds on to the credibility, that adds on to the validity. And this helps the therapist come up with a very precise outline of the mood disorder and as well as its symptoms. The fifth point, practitioners can use these guidelines to diagnose their patients with mood disorders based on the symptoms described. So you could say application of psychology to everyday life. Now, how is it that you put it to be able to answer this question and to ensure that you're not missing on a single mark over here? The criteria ICD-11 have been developed by experts in the field and are regularly updated. This improves the validity of the guidelines as experts review the diagnostic criteria and update them with new findings from research about mood disorders. So what the examiners have done is they have simply picked up this first point, elaborated on it so that the student ensures that he or she gets 2 on 2 over here. Now, another important thing which is mentioned over here, which I wouldn't really recommend you to use, but nonetheless, it is there. This is a paper, this question that I picked over here is from the specimen paper 2024. Pre-2024, we used to use the DSM, that is the Diagnostic and Statistical Manual for Mental Disorders. And it is very recent. In fact, it's from 2024 onwards that the DSM has been replaced by the ICD. So the guidances for the people who are checking the paper allow reference to both the ICD and DSM guides. But again, if the CIE has changed the manual or the criteria that they want to use, we might accept it and follow it as well. So this is how you could ensure that you're not missing out a single mark out of these 6 marks. So 4 marks from 3A and 2 marks from 3B. Together, it makes it 6 marks, 6 up. I hope this has been helpful. Thank you.